afternoon. Happy Wednesday. Happy Winning Wednesday. Happy Wealthy Wednesday. You are tuned into the Legacy Lab right here on Intellectual Radio with your host, Stephanie Miller Henderson. I am super excited and grateful to have you listening in on today, as you may do every Wednesday at 12 p.m. Central Standard Time. This this podcast, every Wednesday. And the focus is going to always be around how we can increase Black wealth. And I want to make sure you don't miss a beat, right? So definitely need you to go and subscribe to the Intellectual Radio YouTube channel. Also, jump on over to my YouTube channel, Stephanie Miller Henderson, or at the Black Legacy Lab, and subscribe as well. You can also follow me on all social media platforms. And so I am super excited. I feel kind of, intense right now, and just a lot of different emotions, I believe. And part of that is because May is Mental Health Awareness Month. And so the color for mental health awareness is green. And so I have on my green God Heals hoodie. And my daughter actually gifted this to me. And so shout out to my daughter, Kenya, who may be listening. And shout out to my amazing, supportive, phenomenal husband, Carlton, who may also be tuning in. Both of them are at work. So if they're tuning in, maybe they took a lunch break or something. But definitely want to shout them out. I absolutely appreciate the both of them. When you think about your family, they're gonna always be those core people that are like your cheerleaders, right? That are always rooting you on, and they just got your back. And so I have a few of those in my family. Definitely want to also shout out my little sister, Rolanda. She had a birthday recently. I don't know if she want me to let everybody know that she finally made it to the 30 club. Uh, but don't stress, little sister. If you're listening to this, don't even worry about it. Women, I don't know why we don't want to tell people our age, but hey, it's a blessing to have made it another year. And so, again, thank you so much for tuning into the Legacy Lab. Thank you so much for, if you are a clinician on any level, if you are a mental health professional in any industry, I want to definitely give you your flowers here today and say thank you for what you do to help people to heal, to help people to become whole, to help people to just realize that they are great just the way they are. So all month long, we are going to have a focus of money and mental health. And we will discuss how money impacts your mental health. And so if you are listening, if you are tuning in via Facebook, via YouTube, or if you're listening via the intellectualradio.com website or any of the podcast stations, I want to welcome you to call in. If you are a clinician, or if you just have an experience with money and mental health that you want to share and give some insight around, definitely do that. Your call is welcomed at 708-223-8953. I would love to hear from you. So, got that out the way. But let me also add, if you are a mental health professional on any level, and let me repeat that, right? Counselor, therapist, psychologist, social worker, psychiatrist, crisis worker, a mental health educator, like, if you are working in academia on any level, whether you are an adjunct professor, a tenure professor, if you are in the field of clinical mental health or crisis work on any level, I want to extend an invitation for you to join me on the show whether, you're in studio if you are in the Chicagoland area, or as a call-in guest if you are located elsewhere, anywhere else around the globe. Definitely want to welcome these conversations. I found that a lot of times we like to separate money. I feel like, money just becomes this like undercover thing that people really don't want to talk about until maybe either they don't have it or maybe they have a lot of it. So somewhere in between, we have to make sure we are talking about it, addressing it, because, definitely if you feel like you don't have enough of it, and if you are struggling, financially in any kind of way, it's the same as, if you were struggling, with a mental health um disorder or issue, if you will, from anything else that may have happened in your life. We tell you to seek support. And so that's what this entire month is going to be about. I'm going to flood you with resources, tools, tips, strategies, things that you can use as it relates to your money and your mental health. All right. So, one of the things that I love to do is, I just kind of consult with my friend Google, and, we just do our thing, right? We definitely, I just try to see, what's out there, what information I can find. We're living in a information age. And so we definitely have information at our fingertips. And so one thing that I found yesterday was that there is a policy institute on money and mental health. It's literally called the Money and Mental Health Policy Institute. And this institute is located in the United Kingdom. So it's in the UK. It was launched in 2016 by a gentleman by the name of Martin Lewis. And this was really a big deal to me because, again, I don't see that people often put the topic together in conversation, let alone to actually build an entire company or organization around money and mental health, right? So I thought that this was very unique, and I thought that this was very profound. And it appears to be three main goals that this organization has. And it includes like making sure that people with mental health concerns are not discriminated against in any type of way, in the area of financial services that they may need, and to really ensure that the support services are accessible to everyone, right? Especially to those who need them, but that there are no barriers with that. And lastly, the organization they had this listed as like their objectives. They want to ensure that the income deficit that exists between those individuals with mental health problems and the rest of the population is reduced. Right? So it's the same, similar if you look at, ways that people may be boxed out or left out because of their race, right? Their ethnicity, their gender, their preference, their sexual preference, all these different things is just another way of boxing people out, right? If you say, oh, well, this person has been diagnosed with a mental health disorder, if you will. And so just making sure that individuals that identify with that group, that they still do not have to suffer financially because of that. Something that was another like eye opener that I saw on their website, they had like a data report. They do research. They have fact sheet, data sheets that you can actually look at. And so there was a highlighted statistic that read that there is a link between money and mental health problems. As if we didn't know, right? Those of you that, and you may not have identified it as that, but I'll talk a little bit later about, what that looks like, financial stress, financial anxiety, financial depression, financial trauma. It exists. It's a thing. Many of us have been there. Some of us are still there. Some of us are getting over it, right? We figured out what to do. And so I want to be able to provide some information around what that looks like, in our lives financially when we talk about mental health, and some ways that we can actually cope, right, with these issues as it relates to money and mental health. And so the statistic that I wanted to point out from the Money and Mental Health Policy Institute read that um 1.5 million people, and remember, this organization is based in the UK, based in the United Kingdom. 1.5 million people in England alone are experiencing problem debt and mental health problems. So just understanding that there is a linkage there, that there's some correlation there between stress, anxiety, depression, money problems. And again, it's okay to talk about it. A lot of people wait until it's too late, you know, just with anything else, like, any other addiction or something like that, if you will. A lot of people wait until they're so far in debt or they're so far behind that it's causing, like, it has totally destroyed everything in their life. And I'm just here to tell you that you don't have to wait until it's gotten that bad. That there are resources, there are people, there are things that you can do to help make sure you don't have to suffer and bring on these mental health issues, if you will, due to money. So let's kind of dig into this stress piece, this anxiety piece, this depression piece. And look, if you're tuning in, definitely comment. Let me know your thoughts about this. Call in. Again, if you have an experience, with a mental health problem related to money, so that financial stress piece, anxiety, depression, whatever have you, definitely call in and share 708-223-8953. And if you're tuning in from on Facebook or YouTube, let me know your thoughts. I would love to hear from you. I want to have some interaction and engagement here during this Mental Health Awareness Month, because mental health is very important. Very, very important. And let me set kind of the stage, if you will. I've been a mental health professional for over 2 decades. I know y'all like, you don't even look that old. Right, because I'm only 25. No, me just saying I don't know why women don't want to tell their real age, and then I tell that fib and say I'm 25. I am not 25. Um, you can add almost you can add a couple more decades to that. But it's been a long time. I want to say before I even hit adulthood, I was working and employed, proudly employed at group homes and shelters, and working with young people who were considered then that term wards of the state, right? They were young people whose parents or guardians had lost custody of them. And so the state had custody. And so they lived in these, various housing programs. And then, transitioned from there and did some other things. Definitely, I worked at the Cook County Jail for a stint, a bit. Um, did some work, of course, then with Chicago Public Schools for well over a decade, currently still, attached on some level. Um, and so after a bachelor's and a master's and something that I thought I would go to law school for, I ended up getting a master's in school counseling. And so, it's just God just has a way of always bringing you back to something. And so, this mental health piece has never left me. It has been a part of my life, my research, my studies for a very, very long time. And so, here we are now, fast forward with having several, business endeavors that have happened over the years, now fully embracing this role as a wealth advocate. Um, because I understand how the lack thereof impacts families, impacts communities, and therefore it impacts our world. And so when people don't have resources, whether that's money, whether it's healthcare or whatever, money is always there. It's that one constant. Like if you don't have access to healthcare, you probably don't have a lot of money. If you don't have access to what you feel is quality education, you probably don't have a lot of money. If you don't have access to the resources that you need to see, doctors or, that are related to behavioral health or mental health, you probably don't have a lot of money. So money is always like that piece right in the middle, again, that people often don't want to talk about. It's like, why can't we just help people grow their money? Why can't we just help families be in a better financial state? Why? Because someone profits off of your poverty. And so the whole premise again of this show is to empower you, to educate you around ways that you can build wealth, but also, just kind of understanding what you're up against. And so, welcome to May Mental Health Awareness Month, and welcome to the Legacy Lab. So, let's talk about this stress, anxiety, and depression. And thank you to those that are tuning in via Facebook. Shout out to Udine, Dr. Udine, who is tuning in. Shout out to Jerquez, who is tuning in, and all of you on YouTube and listening in on all the podcast platforms. Really appreciate it. So, stress, anxiety, and depression. We've heard of those terms. We probably know what they are, and some of us may be dealing with these issues right now, maybe even to the point where medication had to be involved, right? Stress shows up in our bodies. I was just talking about that in so many different ways. I was saying I was a person who never thought like I got stressed out about anything. I'm like, oh, it's fine. I'm good. I'm happy. Nothing's happening. Everything is great. And then I started having, what we would call somatic symptoms, right? You start feeling things in your body, in your stomach, in your, arms, in your hand, wherever. You can feel the stress, which is why, physicians will tell you stress can kill you. So you have to take care of that. Stress can lead to so many other physical ailments if it is not taken care of. There is a such thing as some healthy level of stress. We all stress about different things, and people have definitely stressed about their finances. That's a thing. It happens. However, when it becomes so detrimental that it impacts your entire day every day, then there is a problem where you definitely want to, before that even happens, you want to make sure you're talking to someone and seeking some support. And look, when I say go talk to somebody, I don't mean go talk to your four broke friends, because then, the individuals that I'm around that were building wealth, they say, if you talking to your four broke friends, you're gonna be the fifth one. So you definitely want to make sure you're getting in a community with people that can actually pour into you and educate you well on that front. um So, as it relates to stress, anxiety, and depression, I think we may have someone who wants to chime in on that. So, I'm going to turn it over to the caller. Great afternoon. Thank you for calling into the Legacy Lab. Who do I have the pleasure of speaking with?
Hey, this is Dr. Carlita Hughes and your longtime friend. How are you?
Oh my goodness. My friend, my friend. Thank you so much for calling in. You all, let me tell you about Dr. Hughes, okay? She is my friend of over several decades. Again, back to that age piece. Um, I always brag about the Chicago vocational family, the CVS family, and just how we, stay in touch, we stay connected, how we fellowship, and just, we've done some really great things over the years. And I know and trust and believe that the best is still yet to come. But Dr. Hughes is a physician, she is a pediatrician, and I wanted her to kind of be able to chime in around this mental health piece, right? Not necessarily to kind of dig in on like how money, it can contribute to mental health issues, but just more about like how like what she sees in her practice as it relates to stress, anxiety, and depression, and how that impacts us physically. So, thank you so much, Dr. Hughes, for calling in. I'm going to turn it over to you so you can share with the people.
Oh, thank you. Thank you so much for having me. It is a pleasure, as Stephanie said. My name is Dr. Hughes. I'm a pediatrician. I have my own private practice in Chicago Heights. I'm the owner, director, pediatrician there. And also, I work on the south side of Chicago at Jackson Park Hospital once a week on Wednesdays. But enough about me. I can tell you 100% that mental health and money go hand in hand. So I am not a financial expert at all, but I can tell you the stress of not knowing your next paycheck will come from, not knowing how much you have in the bank, not knowing if you can even handle or be able to deal with tomorrow, definitely can impact your mental health. Not only since the pandemic, I've been seeing more depression, anxiety, unfortunately, suicidal ideations, and homicidal, unfortunately, ideations as well. So mental health plays a big role on financial stress, physiological stress, and people overall well-being. So that's just some of it. I can just tell you, anxiety has shot through the roof, and unfortunately, I'm seeing it younger and younger. I have kids as young as 2 and 3 showing signs of anxiety, and I can tell you, 10 years ago, I didn't see that. That was not the common. Nowadays, little signs that you can see with toddlers showing signs of anxiety. Multiple adolescents having anxiety. And I mean, I have so many patients that have anxiety just going to school, and the support and mental health resources are not there. And the mental health resources we have, they're all overwhelmed. It's very hard for me to refer some of my patients to mental health experts. So I had to educate myself even more so I can be prepared to deal with the influx that I'm seeing. So I can tell you 100% that finances and mental health go hand in hand. Now,
Wow.
saying all of that, I'm sorry,
Hmm.
I can be long winded. Go ahead,
No,
Stephanie.
no, you're fine. Keep going. So keep going.
Most important, I just want to say, no matter what God you believe in, I think people need to make sure that they have some sense of spiritual being and some sense of faith so you can kind of counteract. And I think in our community, we have to take the stigma away from mental health resources. If someone needs help, if someone's crying out, and it can be subtle signs, it can be, say, the football player that used to love to always be on the field. He's throwing the ball. He's active. He's always at the game. He's always cheering on. If he starts to stay in his room a little more, if he starts to not wanting to go out the room, not wanting to hang with his friends, not eating as much, and depression can be eating less, or sometimes in our community, it's eating more. It depends. But you need to keep an eye on your adolescents, your teens, and even little kids. If they're starting to withdraw, things not making them happy, They don't want to look at their iPad or play with paint colors, or they don't want to be with their friends. These are all warning signs. And please don't forget. Now, I specialize in kids, but we can't forget about our elderly population as well. So mental health and finances, especially with our current president, it's a lot of stress, and mental health has skyrocketed in the last couple of years.
Ooh. Wow. Thank you so much for sharing that. I can definitely attest to what you stated about the how, the facilities are overwhelmed, the programs are overwhelmed, and how there's been an increase in anxiety and suicidal ideations. My last 2 years in the school building before I stepped away to finish up this dissertation, I had to do so many more suicidal ideation assessments. And I did have a couple of homicidal ideation assessments as well. And what happens is, we eventually have to link the children or the teens with community resources. And so, I feel like I've seen more close over my 2 decades as a mental health professional than I've seen open. So I know that there was, one on the north side that opened, I want to say maybe a couple years or so ago, Montrose Behavior Health, that did some really good work, with the schools and things like that. But yes, increasing in numbers, but decreasing in resources, and just people feeling burned out and not even wanting to be like in the profession, because vicarious trauma is a real thing. And so if you're not pouring into yourself on any level, or yourself feeling like you have to work, and that may be due to finances as well, but not taking time off for yourself, it's just this circle that is just really getting perpetuated. But what I want to ask you on the money piece, when it comes to healthcare, I was having a conversation with some ladies yesterday, because they were talking about, it was a couple of ladies who are retired, and one of them was saying that she feels like she's retired because she only works, like an hour a day, or two a day. And she works, she said, because she wants to, not because she has to. And I felt like that, that's a blessing. However, she said something else. She said that she works also for the benefits. And so what I told her, I said, well, rich people pay for their benefits. I said, growing up, we were taught that you had to get a good job to get good benefits. Even if it wasn't a job we wanted to do. It was like so many people went into career fields that they may not have had a passion for because of those good government benefits. And so what happens is, when you are financially stable, and you have, that backing in your family or whatever, you have access, what we see, to better health care, right? It's not like this struggle to pay, because even if you have health care from your job or your career, you may not be able to afford a copay, or you may not be able to afford an ER visit. There's always something that you're gonna have to pay out of pocket. And so can you talk a little bit about, like, maybe the stress that you see in that front, or are people having to wait longer to see a doctor because they don't have the money?
Uh, I think the problem that I am seeing personally, again, because I'm pediatrics, I am seeing that people are overwhelming their primary, and also they are using the emergency room and urgent cares as if they're medical doctors. Clinics are their primary clinic. The blessing about having a personal physician or a doctor that takes care of you is not just the medical part, it's actually knowing who you are, knowing your family, knowing your history, not having to repeat the same story every time you go in. I'm horrible with names, but I can tell you every patient's face. My patients, I know their family history, I know their background, I know their likes and dislikes. And honestly, I talk a lot. They know a lot about me that personal connection. So you don't have to worry about your doctor not understanding where you're coming from. That's one less stress or one less form of anxiety that you have to worry about when you have someone who actually cares and listens to you or even know you. That's the benefit and the blessing part. Now, the money part is, again, unfortunately, they're trying to take the power away from medical doctors. So they're calling everybody providers. And provider can be a nurse practitioner. It could be a physician assistant. It could be a medical doctor. You never know. And unfortunately, or fortunately, it depends who you talk to. Just because someone says they are a doctor doesn't mean they went to medical school. And I mean 4-year medical school to become a medical doctor. I'm not talking about, now they're saying medical school when they talk about MAs or nursing assistants, or they just say they went to medical school. So you have to ask. Now, I'm not against providers. Please, I hope you all don't take it that way. But it's just a difference of me going to school for over 12 years and amount of knowledge versus somebody that went to school for 3 additional months. I'm not trying to be disrespectful. I absolutely love nurses. My mom's an RN. And it's Nurses Week. Happy Nurses Week.
Yes, it is.
I'm not trying to be disrespectful. But the amount of knowledge is important. The amount of training is important. The tests that you have to take and the certifications and the background checks and all of that's important. And the continuous medical education to keep your license up to date and active. That's important. So I think the stress part of not knowing if you're getting taken care of well, that's one part. The other part is patients sometimes use Google as facts. Google is just a machine. AI is just a machine. It's not facts. It doesn't know your whole history. I have patients that come in and say, "Doctor, I have the chickenpox." Clearly, it's not the chickenpox. Well, Google said it. I'm sorry, ma'am. It's not the chickenpox. So you just have to be careful. You just have to make sure that you find someone you like and you trust. That's up to you. The medical part shouldn't stop you because ideally we have places in Illinois that will take you whether you have insurance or not. My personal clinic, I see patients whether they're insured or not. That's just what I believe in. I was trained at Stroger County Hospital. They see you whether you have insurance or not. So there's still great hospitals out there that will see you whether you have insurance or not. You just may wait a little longer. It may be a little busier, but you have to give up when you're not paying, right? That's just in life. So I hope I answered your question.
You did. And it people can go and see the doctor and get seen. So at least they have gotten that layer taken care of, like even if they don't have insurance. But that back end piece.
Mental health is so backed up. That's the problem. The
Right.
mental health is not like the doctors or providers don't want to see you. It's so many people showing signs of mental distress because of finances. Finances is just one. Not knowing where your next meal comes from anybody would be stressful. That's a normal form of stress. But just imagine if you have children. Just imagine if you have a family. You understand what I mean? We're in Chicago. Just imagine when it's cold and we don't have heat. So the mental part of finances makes sense. It's just not having enough providers and doctors and people out there to see the amount of people who need it. Yeah. So I really believe not only support of family and friends, but faith has to be a part of it. So you're able to keep an eye on that person. So you're able to ask for help. The biggest part of mental health is letting somebody know you're in trouble. And it's always a saying, the person with the biggest smile is in the most pain. That's sometimes true, so we just have to keep an eye on each other and make sure we're taking care of each other as a community, as a family, as your friend, even strangers. If they look out for you and someone say hi, you say how you're doing. If you're not doing okay, don't say, yeah, I'm fine. Be honest. It won't hurt for you to be honest because you don't know if that person will be able to help you or not.
That is so true. I mentioned that a little bit earlier, like, us as clinicians or, a physician, oftentimes, we may neglect ourselves, just going and pouring. and just not realizing until it's too late that we too are in need. So, you mentioned something, and I thought about that phrase, check on your strong friends. You mentioned something about the person that's smiling the biggest, and that goes like with that saying, check on your strong friends. Don't always assume that just because someone has never complained, or maybe they're always smiling, they're always helping, they're always giving, you probably need to make sure you check in with that person too, because I've seen so many, and that's kind of how sometimes anxiety can be tricky like that. Like I've seen the most intelligent, gifted students who has severe anxiety to the point where it kind of opened up the door for some suicidal ideation. So definitely, these mental health issues, concerns are sometimes like a gateway drug. Like it can start off one way, and then it escalates to something else because we're not taking care of it. So I absolutely appreciate you, my friend, my beautiful friend. Now we need to get together very soon. So thank you so much for calling in. I love you. I appreciate you.
I pray that I was helpful. I pray for everyone for good wealth, good health. And at least if you need anything, please, I ask you to reach out to someone. And I pray that you get the help you need.
Yes. Thank you so much, Dr.
You're
Hughes. All
welcome.
right.
Okay, have a blessed one.
You too. My. That was great. I'm an expert in what I'm an expert in, but I am not a doctor. I am not a medical doctor. I will be Dr. Stephanie Miller Henderson very soon, but it's not a medical doctor. So, we have to hear from the people, like Dr. Hughes said, the people who've gone to school for 12 years, she said, to study, their craft. And so she talked extensively about that, how financial stress, anxiety, and depression can show up physiologically in our bodies and start to take on other, ailments. Let's say high blood pressure, um, diabetes, even cancer. So understand, when people say stress kills, that's like a basic statement, but it's so serious. And so when it comes to your financial health, financial stress, anxiety, and depression, it's like wondering where, like the doctor said, your next meal is going to come from. That worry and that stress is when you talk about your next meal, where your next meal is going to come from, how your bill is going to be, your mortgage is going to be paid, how this is going to happen. That is all money based. That's financial based. And so you're having a traumatic experience from finances. So we call that financial trauma. Money is not the key to a lot of things, but we often, those of us that are wealth building advocates and trying to show people how to build wealth while we're building it ourselves, we're actively involved in this thing. We understand that it takes money to not only take care of yourself, but take care of the people that mean everything to you. So we have to stop acting as though we can't have this conversation. It's like it's the secret conversation. You hide your hands, hide your money while you counting it, all the things, or you look like $1,000,000. Meanwhile, your bank account is negative, whatever, whatever, whatever. But you have on a $1,000,000 worth of merchandise, but not $1,000,000 in your pocket, if you will. And so, oftentimes we like to live like that. And I definitely can say, you know, maybe in my 20s or something, I was guilty of that as well. And that alone, when it starts to sink in, can definitely cause stress as well. So if you're just tuning in, you're tuning into the Legacy Lab, 60 minutes of Black finance ways to increase Black wealth. And this every Wednesday, we're having a discussion at 12 p.m. Central Standard Time right here on Intellectual Radio. And so I'm super grateful. And let me shout out Wanda and Earl if I did not do so earlier, because they give people like me an opportunity to use their voice and have a platform to do so. And so I'm grateful for that. Now, let me share. When we're, because I can't end problem based. We have to. I'm gonna always provide some solutions and a way out. When it comes to resources, we live in the United States. I know, a lot of people are side eyeing us today, but we definitely live in a country that has a plethora, a wealth of resources, right? Um, and tons of research and resources that have been done or provided around financial stress, anxiety, and depression. I, in my search, and I always do, like, let me say, we are living in an information age, and so that has its pros and its cons. So while you may be able to Google something and quickly get that information, I love that. But I have to cross reference. You cross reference because you want to check the validity of a source, right? And so it's the same thing where you're utilizing the search engines on the World Wide Web, because people can alter those things, right? And so being cognizant of what you're reading is very important, because you don't want to have, be misinformed, thinking that you should be doing one thing where you really should be doing something else. And so, again, that too is one of the reasons why it's so important to seek professional help. Um, so Chicago, we are the third largest city in the country. We have so many resources and tools. Here in this city alone, we are a global city. I often point that out. We have in this city um, a network called the Financial Health Network. It began in 2004, and now for over 2 decades, for 20 years, they have worked to create this powerful movement of, like, leaders and organizations that believe that everyone deserves to have a great or an improved financial life. And so when looking at how money and mental health collide, I had to figure out, like, well, what do we have at our fingertips that we can utilize and leverage? Their headquarters are right here in Chicago. They're in downtown Chicago. And so, again, that's the Financial Health Network. I'm going to dig a little bit more on this network. But they had a powerful statement regarding why they do what they do. And so, like the Policy Institute that was in the United Kingdom that I talked about earlier, I thought that this was great, because here I am, this mental health professional, now turned wealth advocate, right? Because I've had my own financial trauma and stresses and struggles. And I just simply said, I'm not doing it again. I said, I'm not going back. I'm not going to put, I'm going to be the example in my family. I'm going to set things up, for my daughter. I look at I hear people talk about how they retired their husbands. I want to do that. I have nieces, I have nephews. I look at my community, and I just simply said, I'm not doing it anymore. And so when you get to that level, when you get sick and tired of being sick and tired, as we say, you'll start to figure it out and start to look for things as well. Whatever that might be for you. I always share with people, for me, it was investing in the travel industry, because it's something we already do. But for others, it might be something else. Whatever it is, you need to figure it out, or else you're never if you don't change, nothing changes. So I want to point that out. But you have this financial health network right here in Chicago. And the powerful statement that they had on their site, it said that financial health is about more than how much money a person has. And I love this. It's about having a financial system that allows them to weather unexpected expenses and achieve long term goals. Because even when we start, I'm nowhere near where I will be at the end of 2025 or next year, 2026, but I am in position, right? I have aligned myself with the business opportunity, in addition to the things that I feel that God has told me to do, I had to have a vehicle that was going to help drive me there, right? It's just like saying, I want to go to Paris, but I only have a bus pass. You have to make it make sense, right? If you're saying, I want to earn six figures, I want to get rid of debt, whether it's credit card debt, student loan debt, I want to retire early, or I can't retire because my whatever that thing is that's ailing you, that's stressing you, that's causing anxiety for you, and maybe even have you depressed. You have to figure out the vehicle that's going to drive you there. You can't keep saying that you're in this thing and you want out, or you want to plan, or you want to make preparations, but you still working on a bus pass, trying to get to Paris on a bus pass. Not going to happen. It is not going to happen. So, systems, having a financial system. Some of those systems may look like some of the things that I shared, whether it's, budgeting, whether it, the financial literacy things that we talk about, increasing credit scores and things like that. But it's always going to boil down to income. What do you have coming in? How are you making more money so that you can have the emergency fund? The Financial Health Network said that the financial health allows people to weather the storm, if you will, weather the unexpected expenses. I forget the statistic. We know that 78% of Americans are living paycheck to paycheck, but there's a large percentage of Americans that don't have $1,000 in the bank for an emergency. And so that's a problem. And that causes stress, and it causes tension in the household and the family. And I want to point out something that Dr. Hughes said that is very important. And I have on my green God Heals hoodie because green is the color for mental health awareness. But because I am a believer in God and I'm a follower of Jesus Christ. And so that's my faith. Like she said, whatever your faith is, whatever God that you choose to serve, you need to have that spiritual man in check, because when all HELL looks like it's breaking loose, how do you have joy in the midst of such a crisis or tragedy? That only comes when you are able to tap into something greater. And so when you meet people that seem like they're always able to have a smile in the midst of all the adversity they're facing, well, that probably has a lot to do with their faith. I'm not going to say probably. I'm going to say 100% of the times that has to do with their faith, right? Because how else do you not go insane in a situation that so many people would have done that? So let's look at some staggering statistics that the Financial Health Network had listed on their sites. 70% of Americans were not financially healthy in 2023. 28% of Black Americans were financially vulnerable. Goes back to what I was saying. When you say financially vulnerable, that's like something happened in my household and I can't cover it. 28% of Black Americans were financially vulnerable, more than twice the share of white Americans. 90% of people with disabilities were not financially healthy in 2023. Last month, you all, I highlighted Autism Awareness Month, and I talked to people, business owners who were on the spectrum. And so that statistic is definitely staggering and concerning, that 90% of people with disabilities were not financially healthy in 2023. Then the last statistic that they had, I want to highlight, 51% of Americans spend the same or more than their income, the highest since 2018. And so when you think about that statistic that I always throw out about how many Americans are living paycheck to paycheck, that is why people are living paycheck to paycheck, right? Because you're spending the same or more than your income. And that is how Black people are able to have a $1.8 trillion spending power but own nothing, because you're spending the same or more than your income. And so that spending piece is a problem. And a lot of times that is even tied to mental health, right? Wanting to look like and appease and appeal to people by any means necessary, whether that is, the way you dress, the way you look, the way you wear hair. That's a self-worth, a self-esteem, self-awareness concern that again can open up the door to that stress, that anxiety, that depression. So wow, I want to make sure I close out with ways that you can cope, that people can cope, people in your life can cope, or you yourself can cope with financial stress, anxiety, depression, and trauma, which all of those terms really boils down to emotional tension that's related to money. And we're going to keep it real this month. Like any mental health concern, it becomes a problem, like I stated earlier, when it starts to affect your everyday life. So I want to say, if you are in the city of Chicago, if you call 311, you can get a whole lot of resources. If you seek the Department of Health and Human Services, you can see a whole lot of resources. If you are anywhere across the globe and you dial 988, that is a national crisis hotline, like dialing 911. Someone is in a mental health crisis, you can dial 988. But if you are just looking for tools to kind of help guide you because you're feeling the crunch, you're feeling it, visit helpguide.org. Some good coping strategies and things that you could do there. According to Very Well Mind, some tips for coping included, and much of this is what has been taught on this podcast. It includes creating extra sources of income, streamlining your budget, understanding the debt cycle, and practicing relaxation techniques. I shared, and I'm talk to. I think I probably asked Dr. Carlita Hughes about this, because I was like, doctors are going to start prescribing vacations. You could say what you want to. The ocean, that ocean front is like medicine. It might as well be an antibiotic. Okay. When you go to the beach, for some people, it might be just a big city with good food, but it just does something for you. And that something is actually impacting your brain chemistry. So, neurologically, it's a lot of things happening when you are on vacation and you're feeling all the joy and the tingles that come along with being able to separate from life for a minute. And so, again, that's another reason why I invested in the travel industry, because I'm going to tell you, I'm going to be the first to hear it here. People are going to be prescribing the beach. Okay. It's medicine, I tell you. Um, but that is some coping that you can consider. And then the last thing is this. Chicago, if you're in Chicago, every Monday from 6 p.m. to 7 at 9525 South Halsted, I will be facilitating a free workshop teaching people about passive leverage and residual income and showing you how you can start a viable home-based business. This is free and open to the public. Again, that's going to be every Monday. And I'm calling it, it's a mental health Monday. It's something I used to do when I was in the school building for the community and for parents to come and get mental health resources. So now I'm doing it in the community, but it's wealth building resources. So shifting gears a bit. So again, that'll be every Monday in May from 6 p.m. to 7 p.m. at 9525 South Halsted. It's free, but it's going to be a powerful hour of information sharing. That is it for the Legacy Lab on today. But be back next Wednesday with both your ears and ready to hear more about this money and mental health piece. Thank you so much for tuning in. See you next Wednesday, or hear you, or maybe you call in or you see me or you hear me next Wednesday at 12 p.m. Central Standard Time on the Legacy Lab. I'm your host, Stephanie Miller Henderson. Be blessed. Have an amazing Wednesday.